patients always ask me about biomarker testing for lung cancer. In many high volume academic programs, next generation sequencing and molecular biomarker testing is done almost on a reflex basis. Now, that is not currently standard across the nation, but it is important for patients to learn to advocate for themselves and to know that biomarkers or molecular markers can be used to identify what we call actionable targets. They can be used to guide therapy selection for patients, and it's not as common that it's used in stage 1 super early lung cancer, but molecular markers are important because they can help us assess whether or not PD-L1 inhibitor therapy is an option. And those are certain drugs that are classified as PD-L1 inhibitors. So we send the patients for PD-L1 testing. And it divides non-small cell lung cancer into different subsets based on what we call driver mutations. And a lot of my patients get confused and they don't understand genetics and they don't understand molecular markers, but they hear so much talk about it that they really want to understand it, and they really want to understand what types of testing should they be advocating for. So in general, I tell my patients that if you have something besides the earliest stage of lung cancer, you might want to start thinking about it and initiate a conversation with your medical oncologist about it. You can also bring up the topic with your surgeon, because your surgeon will be able to pull tissue out from the cancer and send it. And then in other programs, we'll be taking the pieces of the tissue and banking it so that we can do extensive testing later on. So molecular testing can be performed on tumor tissue, which is from a biopsy. It can be done from cells, or what we call cytology. So if we pull some fluid out of your body, we can do it that way. And then there are other tests that are from the bloodstream, which is called cell-free DNA, which is where we take tiny fragments of DNA that are circulating in your bloodstream, and we test those fragments of cells, looking for specific markers that might indicate whether your cancer is present or if it's gone away and now it's coming back. So the use of what we call multiplex or next generation sequencing platforms, really that's done in systems and in programs where they're using that data to identify novel, actionable driver mutations to find treatment that might be unusual to treat your lung cancer when the traditional treatment doesn't work. So that's the easiest way to describe where we are with molecular testing right now. But I do recommend every patient initiate a conversation with your medical oncologist about that topic, because every institution's different. And frequently, there are many clinical trials that patients can enroll into that cover the cost of molecular testing.